medical oncologist, hematologist for over 30 years. In college, I worked my way through as a lab technician in a hematology laboratory, but soon realized medical oncology was where the action was going to be.
A friend of mine that I knew was going through cancer, really aggressive breast cancer, just popped up on Facebook, and she wrote, "I don't know how it's supposed to be, but I know it's not supposed to be like this."
After several days of just being sick, not being able to drink or eat, we ended up in the ER. And I knew I was dehydrated and needed help. A simple IV that should have taken maybe an hour or two, we were there 5-6 hours. It was crazy. And I got home and I cried. And I said, I don't know these doctors. I don't know this hospital. It's not right.
And all I could think to do was ask, do you want me to call my oncologist for you and see if there's a better way? And she just said, please.
I didn't hold out much hope because I'm thinking, this doctor has all these patients. How is he going to see this one woman in the middle of a treatment?
You don't get to call a doctor very often and say, hey, I'd like to see you. And he says, great, come see me tomorrow.
Within maybe an hour, I got a call from his office, and it was his nurse. And I had an appointment the next day with him. That doesn't happen, does it? And Dr. Needles came into the room, and he was like, I have this. You're gonna be fine. And my husband grabbed both my hands, and it was like we were kids in a playground. We grabbed hands and we jumped up and down in circles, and we were just so happy. It was like somebody had taken a huge weight off my shoulders. It felt like I could breathe for the first time.
And he said to me once that I would have done so many things differently. Well, he did so many things right.
To know that he has allowed me to continue to be a mommy and to be a wife, I don't know if there's a word. Thank you it doesn't seem enough.
A patient should never be left without some degree of hope, some degree of optimism. It goes so far to ease the fear that they're not alone.